I'm here to talk about the Affordable Health Care Act and the impact that it has had on Louisiana. As Melinda said, I'm director of a public health foundation in Lake Charles and Lafayette. And in early 2013, before the Affordable Health Care Act was about to roll out, we entered a consortium with the other 3 area health education centers in the state, and we call ourselves Navigators for Healthy Louisiana. In 2013, and then 14, and then 15, and so forth, we have been awarded the statewide Navigator contract by the Centers for Medicaid and Medicare Services, where we would serve as, and we put navigators throughout the state to help serve as in-person assistants for people who are trying to determine eligibility and understand the new law, as well as understand the marketplace and what that meant for consumers. And so we were able to cover the entire state. We were expecting our new contract to begin on September 2nd of this year. We were to be funded just like we had been funded before. And then all of a sudden at the last minute, the brakes came to a screeching halt. And so one of the things that came out of the administration this year was you saw that they were going to cut outreach and advertising for 2018 by $100 million. So it went from a $110 million budget in 2017 to a $10 million budget in 2018. In addition to that, they cut the amount of in-person assistance that consumers were going to be able to get. So our project was cut from a $1.01 million grant to a little shy of $300,000, which meant that we had to lay off 13 assisters across the state. Based on the award that we've got, it left us with one person to help in the community of Lake Charles, one person in Lafayette, one person in Alexandria, one person in Lafayette, and one person in Baton Rouge. Folks in Shreveport and Monroe and Natchitoches, all along the I-12 corridor and down in what we call Bayou Land, which is Lafourche and Terrebonne Parish, the Houma, Thibodaux area. There's not in-person assistance other than some of the federally qualified health centers, or of course agents and brokers who can also assist consumers. But that being said, with the advertising that's been cut to the state of Louisiana, the amount of in-person assistance, we have seen a quite robust open enrollment period so far this year. The latest numbers we have are as of November 18th. We have 25,502 people have enrolled in healthcare plans through the federal marketplace. This is 19,163 people who have renewed their current plan, with an additional 6,339 people who are new to the marketplace. I want to remind you, and this is a conversation we were having just a few minutes ago, the federal marketplace is a safety net for people to have health insurance who do not have access to it in otherwise places. The majority, I would imagine each of us probably in this room, have access to our health insurance through our employers. And that's where most of the people in the state of Louisiana get it. The federal marketplace was designed to create a platform for people who don't have access to that. These are employees who probably work for an organization with 50 or less employees. They're not required to cover, mandated to cover insurance, so they would need to get their health insurance there. There's a number of people who have left major business to create, small entrepreneurs to create small business shops, glass blowing, collectible stores. These folks are starting off on their own businesses and don't have access to health insurance for a health insurer employer. These are the kind of folks that go to the marketplace. Over the last year, we've seen several things that have happened to the marketplace under the administration to try and stabilize them a little bit more. The biggest thing I think that concerns consumers the most is that open enrollment was cut down to 6 weeks. So traditionally, open enrollment has been ending at the end of January, but this year open enrollment ends November 15th. So it's only a 6-week period in order to have people in place. But for those that enroll, they will have insurance in place by January 1st. And the purpose of that was to try and bring it more in alliance with the Medicare open enrollment process. Also, one of the other things that were done, one of the marketplace stabilization, is that for consumers who still, I don't know that this has happened a lot. We certainly have not heard any stories of this happening. The insurance companies say this happens a lot, but people get towards the end of the year, okay? They get towards October and November and they say, all right, I'm healthy. Okay, I'm not going to pay my last month anymore because I'm going to take a gamble that nothing is going to happen to me before the end of the year. Well, now before you enroll in 2018 insurance, if you have any outstanding premiums that you to the insurance company, you must take care of those before you're able to enroll. It's not outstanding health care cost, it's outstanding monthly premiums. So that was a big part of that. Louisiana in the marketplace has 2 insurers this year, okay, which we've been down from 5 to 4 to 3 and now 2. That's Blue Cross Blue Shield of Louisiana, which most of us know the Blues. I mean, they're the ones that cover a majority of the people in Louisiana. And then there's also Vantage Healthcare. Vantage Healthcare was started 21 years ago by a group of physicians in Monroe. And so they decided to go ahead and start their own insurance company that they felt would be more friendly towards physicians than others. And so this has grown. As a matter of fact, I was talking with someone from Vantage last year that told me, that since the open enrollment, they have enrolled as many folks in open enrollment as it took them 19 years to enroll. So they're hanging on there strongly, and they provide good services to the folks of Louisiana as well as Blue Cross Blue Shield. One of the things that makes Vantage a little different is they also have healthcare clinics. So if you live in northeast Louisiana, you also have the availability to their Infinity clinics at Vantage, which will also give you deeper discounts on your insurance out-of-pocket cost. One of the things that we see this year, that we see a lot, is I want to talk a little bit about healthcare insurance premiums, and those are for the folks in the marketplace. Out of the folks in the Louisiana marketplace, and last year we looked at around 140,000 people, okay, 88% received some type of assistance to make those monthly premiums. It's only 12 people that are above 400% of the federal poverty level that do not receive any assistance to be able to pay for that. In 2016, on July 1st, 2016, we expanded Medicaid. And so that meant the parameters for the federal marketplace went from folks between 100 and 400% of the poverty level to 138 and 400% of the poverty level. Those folks were about 60 to 70,000 between 100 and 138% of the federal poverty level. Those all moved over to Medicaid expansion, and those folks are enrolled in one of the 5 managed care plans through Medicaid. So this brought our numbers from 214,000 in 2015 to about 140,000 in 2016. Okay, that's where we saw that big drop. And again, like I said, 88% of those receive advanced premium tax credits. One of the big things that's impacted this year's premiums are the cost savings reductions. And a lot of times I think the media and the press and just people talking about it have used the word subsidy to talk about the cost savings reductions. And that makes it really confusing for consumers, because when we talk about subsidy, what we're really talking about is the advanced premium tax credit. That amount that a consumer will receive each month to help pay their monthly premium. And that is based on the amount of money that you make. The closer you are to 138% of the federal poverty level, or 1.38% of the federal poverty level, the closer you are, the more subsidy you get. As you make more money, up to 400% of the federal poverty level, that subsidy decreases because you have more take-home pay, and you should be able to pay more towards your insurance. Those are what we call the subsidies, okay? The cost savings reductions were a little bit different. Those are something that is afforded to folks between 138% of the federal poverty level and 250% of the poverty level. And what those are additional assistance besides the monthly premium assistance to help pay out-of-pocket costs. These cover co-pays co-insurance, other things that might come out of a consumer's pocket. And if you think about it, if you're only between 1.38 and 2.5 times the federal poverty level, these are things that you normally would not be able to pay for. And these are the things that you saw the administration cease last month. Since the beginning of 2017, whether or not the administration would reimburse the insurance companies on these cost savings reductions is something that has been in the air, and the administration has decided on a month-by-month basis of whether or not they would do that. A lot of times people like to call these insurance bailouts, but they're not insurance bailouts because these are just pass-throughs. I mean, in other words, if you're the consumer and you go to the doctor and the insurance company is paying your copay, let's say it's $40 for the plan that you're on, that is the insurance company is paying that $40, and they expect they were going to get reimbursed by the federal government for that $40 for that consumer. It was just passed through the insurance company. It's certainly not a bailout. But those have been trying to figure out, those have been in play for the last 8 months, since January. And so one of the things the administration did, in the end of November is that we will no longer pay those. Well, cost savings reductions, the CSRs, are part of the Affordable Health Care Act, okay? They are written into the law, and so consumers will continue to get that assistance. The only difference is the insurance company will no longer be reimbursed for that. So what the insurance company did when they filed for their 2018 rates was they anticipated that this would happen. And so that's why you see rates in 2018 increasing in the federal marketplace anywhere between, let's say, 26 and 36%. I think Vantage had around 26%. Blue Cross Blue Shield had between 32 and 36% increase in their premium rates. Both Vantage and Blue Cross Blue Shield said their rate increase for 2018 would only have been 6%. If they could have been guaranteed those, but they couldn't, and they needed to make up that cost someplace else, and they put that onto the premiums. What happened, and what's ironic about that, is because the advanced premium tax credits, that monthly assistance that you get each month to help pay those premiums, those are based on those second lowest cost silver level plans. So when those plans dropped up, those advanced premium tax credits dropped up as well. So what happens is what's costing the government billions of dollars more, okay, it's not saving money, it's actually costing money, but what we see here in Louisiana is the consumer is winning. Because that even though the premiums went up by 26 to 36%, their advanced premium tax credit grew up even higher. And so I think one of the things that we see such a robust enrollment so far this year is because people are able to get better plans than they had in 2017 and pay less. Many paying 0% monthly premiums because that subsidy to help pay that went up because it planned. So it kind of for the stabilization kind of backfired on them. But who wins in Louisiana? The consumers end up winning. Now, that's the consumers who fall in the 88% percentile for receiving advanced premium tax credits. Those other 12% in Louisiana who are above 400% of the federal poverty level, what they saw was they're seeing their premiums jump by sometimes 36% without getting any assistance in paying for that. And these are the folks that are having a really hard time with this health insurance. I want to take some questions because I think that I just kind of wanted to give you a brief overview of what it looks like in Louisiana. I think that a lot of times the questions kind of tend to bring about more conversation. So I'm going to open this up at this point to anybody who has any questions. Yes, sir.
The enrollment numbers you detailed for this year so far, can you repeat those? And then I don't know if you have enrollment numbers for last year or just comparison as to how they've increased or decreased.
I don't have those. I can get those for you, but I will give you the numbers. These are as of November 11th. I'm sorry, 11/18, November 18th. So in Louisiana so far, 25,502 people have enrolled in the federal marketplace. Of those 25,502 folks, 19,163 were renewals. These are people who went in, looked at their current plan, compared it to the system, compared it to other plans, and decided to continue the plan that they're on for 2018. And of that 25,502, 6,339 are new people to the federal marketplace. Yes, sir.
All right. Getting to the shortening of the registration periods,
Sure.
sign-up periods. I mean, just frankly speaking, would you call this Washington trying to play politics with?
Well, I'll tell you, I hear a lot. I hear a lot of people talking about, that this was a way to sabotage, the marketplace. But I'll tell you this: what we saw last year in 2016 was most of everybody had enrolled by December 15th, 2016 last year. I think what happened is they saw a result of the election. They were afraid that they were going to not lose access to health care come January 21st. And so what they wanted to do is they wanted to enroll by December 15th. Remember, the 15th is the magic day because you have to enroll by the 15th in order to have your insurance in place by the 1st. So every person that we enrolled throughout the state between December 15th and January 31st would have had access to a special enrollment period. That's that special thing that allows you to enter the insurance marketplace because of you've lost your job, you've had a child, some extraordinary. Every single one of those that enrolled would have had access to it had it not still been open enrollment period. So I have faith that the people in Louisiana will still be able to enroll by December 15th because they did it last year.
And as for the process now, would you say it's more confusing this year versus last? Again, just sort of.
I think the process, one of the things the Center for Medicaid and Medicare Services have done is the healthcare platform has been increased tremendously. There are all new kinds of ways to go in and do window shopping without setting up an enrollment. So that process is easier. I think what is confusing for consumers is the rhetoric that we've heard over the last year. Majority of the people we talk to believe that the individual mandate has already been repealed. And one of the ironies about this is that folks will not realize that it was not repealed until they sit down to do their 2017 taxes, which is going to be somewhere after January 31st, but before April 15th. So when they sit down to do their taxes and they meet with their tax person, they're going to realize that if they did not have insurance, they're going to be hit with a pretty healthy fine, okay, because it was not repealed. At the same time, remember, open enrollment is December 15th, so it will be too late for them to enroll in 2018. So they will be hit by the fine this year and the next year. So I think that there has been a lot of talk, which confuses consumers, and I think that's the number one thing that we hear, is that most people think that it's been repealed. Another question. Yes, sir.
What is your assessment of the concept of automatic enrollment as proposed by Senator Bill Cassidy?
Okay. Well, that's, so what I can talk about is the law as it is. Okay. I have some opinions, but I really am not, funded by CMS to talk about what could happen in the future. I think that, it's an interesting concept, but I don't have no opinions on that. That would be an opinion. So, yes, sir.
Senator Cassidy inferred continuously before the Affordable Care Act was passed that as a Medicaid doctor, that these hundreds of thousands of people would just be simply getting a card and could not access service. He also inferred that general people that have regular health insurance and went to Babbage Clinic would find they are also locked out because of the hordes of people accessing service. Was he correct in general that services are now restricted because of the Affordable Care Act?
I don't think so. I think what I could tell you is the number of folks that between, July 1st, 2016 to today, that we've enrolled in healthcare, that have access to healthcare for the very first time. What I don't think people realize is we talk about expanded Medicaid. What expanded Medicaid did was it just expanded the eligibility for people in Medicaid. What they have, and it's not like what we tend to think about the old style Medicaid where it was state-run Medicaid and all of that. I mean, it is still state-run, but when you enroll, when you are eligible for Medicaid, you enroll in one of 5 different managed care providers, okay? And yes, there are challenges. There are challenges with, seeing specialists sometimes. But the most important thing is that you get assigned a primary care physician when you are determined eligible. You can choose between a list of them, but for many folks, this is a step in their first step into healthcare. They get assigned that primary care, and that primary care physician is so important to them, even until they can see a specialist. So what you don't get when you get emergency room care, and this is the other part of that, is that when a person who's not insured comes into the emergency room, those that are insured are the ones that are paying for it, okay? And so now that these folks have that, emergency room care is not primary care. Okay, you go in. Their job is to make you well enough to walk out, and it is not managing your healthcare system. So I think that's one of the things that you see now is that these folks have, and we're about 430,000 are the number of people in Louisiana who have now enrolled into expanded Medicaid. Yes, sir.
All right. So just to run down the numbers, I think you had reiterated these before. So last year, your organization had 1.01 million, and this year 300,000 more or less.
It's okay. Let me make sure just the number. It was 1.03. So it was right at 100,000, 1,003,000. Okay, and now we received 297,000. So we were cut. So there were part of the Affordable Health Care Act law says that each state must have 2 types of Navigator entities. One needs to be statewide, basically, and one needs to be regional. So we were the statewide entity, and Family Road of Greater Baton Rouge served as the local for Baton Rouge, served as the regional one. Okay, they received a 99% cut to their budget. They went from right at $500,000 to $10,000. Well, there wasn't much they could do with that $10,000, and so they signed away from it, which left just us, the only Navigator entity for Louisiana.
Yeah. And so as you speak about, some of the good sides of these changes, I guess as an organization now, what's the biggest struggle, your biggest concern now with the diminishing funds?
Well, I think the biggest concern for us is, we have built these relationships with consumers who needed assistance over the last 4 open enrollment periods. And it's not just the open enrollment, it's afterwards. It's the data matching. It's any information that they come. Most people can hear the information, go to healthcare.gov, and they can enroll. The people that come to us, 9 out of 10 times, the very first thing we do is help them establish an email address because they don't understand how to use the system. They don't understand how the insurance works, and so they need to have their hands held through the process. So for us, what kept me up at night and what still keeps me up at night are folks in Shreveport, in Monroe, in Natchitoches, in Thibodaux, in Abita Springs, and on the North Shore that really don't have access. It's the folks in New Orleans. We have 1 Navigator for all the city of New Orleans, 1 for Baton Rouge, Now, we were able to work with partners in many of these communities, like federally qualified health centers or hospitals who are able to have an enrollment person that could help. But when we talk about the I-12 corridor, when we talk about all the way from Livingston Parish to St. Tammany Parish, there's nobody. There's nobody to help those folks enroll. So, that's the biggest concern that I've got. Yes, Melina?
As a follow-up to that, in terms of the money that is provided for Navigators, is that the only pool of money available as these grants, or they're not nonprofit funds or other pools of money that are available to help?
There are community foundations. There are other ways to look at that. We had not looked at that because we were, during the summer when we got our notice of award, it had our money on there. We had to come up with our budget. Everything was set. We thought we had it set. And this was something that the administration did at the very last minute, was to pull these grants. And so...
something y'all are looking at doing going forward?
Yes, we will. Yes, we will. We're looking for many ways that we can... there's many resources we can. And I'll tell you, what's interesting is that where we lost the money in outreach, because part of the budget, not only did the federal government provide outreach for Louisiana, but we also factored into our budget, to provide outreach as well. And so we cut a lot of that, But the community has come up more than ever. You know, what we saw many community groups across the state who fought against HACA and BRCA, and they fought against Graham Cassidy, and they fought to keep the system in place that we have. And so then they came to us and said, you know, we fought all year long for this. What can we do to help? And so all of a sudden, you know, at the last minute, we were learning how to train community folks in understanding what the Affordable Health Care Act is, what kind of information you need to give out, how to talk to people about it. And so, you know, where we lost the funding, we've really picked up in community support over this. Yes, sir.
Yeah, one more follow-up for you. While you're here, there's this back and forth between Governor Edwards and the legislature, their joint budget committee, their appropriations team in the House regarding these managed care contracts, and the governor's office now looking to their so-called emergency contracts. Is there any particular reaction or anticipation as that process moves forward?
Well, I don't have any. That's a little. I mean, I pay attention to that. I know what's going on, you know, but that's not within my realm of field to talk on. So, yes.
In terms of the fact that open enrollment and that the marketplaces have been up and running for a while, do you see increased or decreased need for navigator assistance as people become more familiar with the process and learn how to sign themselves?
I think our ultimate goal and was to get out there and to give the education, you know, for example, so we did a lot of work with non-traditional young folks. I mean, we really wanted to be able to affect the risk pool in Louisiana by making sure that the young, healthy people were enrolled. And so we did a lot of outreach at community colleges. What we find is at traditional colleges, LSU, Southern, McNeese, UL, you know, those folks are mostly still under their parents' insurance until they're 26 years old, okay? But it's the non-traditional schools. It's your welding schools. It was your EMT schools and your cosmetology schools. Those are the folks that do not have outreach to that. So what we've lost the inability to do outreach at some of those places right now, okay? Because our folks are just spent the time enrolling. And so what we you know, that could affect in the long run what the risk pool looks like, because if you don't get the healthy people in, you just are just getting the non-healthy people in. I'll come to you next. But at the same time, so our number one goal is to, you know, with those folks is to teach them how to make sure that they understand it, make sure that they understand that it's still the law of the land, what the penalty is for not having it, and hope that they go to healthcare.gov and sign up for it, you know, and provide them with any technical assistance we get it. But we know there's a huge part of our state, okay, and these are most of the folks that are enrolling in this right now, especially with Navigator services, that the computer literacy is not their strong suit. And so they need some help enrolling in that process and having their hand held and explaining what the differences in the plans are, how the difference between a PPO and an HMO, and how you know the difference of those prices, but what you get from that, how the more you pay in premium, the less you may pay in out-of-pocket cost, but the less you pay in out-of-pocket cost, the more, I mean, the more you pay the less you pay in a premium, the more you're going to pay. How all of those affect that. They need help in understanding which one of the medications they take, which companies are going to be able to cover that medication. So yes, I think there's going to be a need for all of those folks. You know, I don't see them changing, and so I think there's going to be that need. Yes, sir.
What about going to churches and civic organizations and clubs?
That, you know, that has been a big part of our outreach, and throughout the year, this is what we work with a number of organizations. So, for example, one of the things that we've done throughout the year, and I don't think had we not been in this position, we'd have realized the number of big box stores that have closed. The Kmart's, the Searses, the Route 21, the Payless Shoes, all of those folks. And one of the places the Navigators did was when these stores announced that they're closing up, we show up and we sit down and we work with these folks and we say, okay, you're going to lose your employer-based insurance. You know, if you're below 138%, let us help you get onto Medicaid until you can get your next job, okay, or into the federal marketplace because you apply, you work for an SEP. We've worked with the drug court systems, okay, you know, the Louisiana Supreme Court system and the drug courts, because as these people get adjudicated and go into drug court as a form of, form of minimal sentencing. You know, what we need to do is we need to get them access to health care so they can have the medications that they need for opioid prevention or the rehabilitation services or things like that. So these are some of the things that we do throughout the year. We work with churches. We work with all types of organizations to make sure and try and find that. So the answer to your question is yes. Yes, ma'am.
Hi, Latonya with Healthy Louisiana.
Okay.
We serve over 500,000 members here in Louisiana, and I was wondering, and we have on our social media outlets and some other forms of communication let our members know that we've educated them about the actual date, but I don't know that we've gone beyond that. So, do you have any advice for those of us in the room who do handle communications and we have access to communicate to our members, what we can do to better get that information outside of just this is the enrollment date? Because a lot of the things we talk about is what, in my opinion, I think most important.
I understand that. So one of the things I would suggest doing is to follow us on social media. You know, our website is LA Healthcare. This is all one word. LA Healthcare NAV.com. Our Louisiana Navigators on Facebook. LA Navigators on Twitter. You know, and so there's several different social media platforms. But if you follow us, and then you're able to share the information we put out there. Also, before you leave, I will give you my card, or anybody else who wants that. And what I will do is connect you with the Navigator in your community, assuming you're from one of the 5 communities we have remaining, to help you craft whatever messages you need to be able to get to your constituency.
Awesome, thank you.
Yes. Other questions? Yes, ma'am.
How much does the Navigators make? What's that average?
Okay, so Navigators, you know, we're not agents or brokers. Okay, so what happens is we don't receive any type of commission or anything like that. We are public health people, so we're just like, we'd like state employees. I mean, but we're not state employees, but our job is to explain that. And it's a salaried position. And it's anywhere from right now between $35,000 a year. I mean, it's on a very low end. We have folks that are just getting out of, you know, that just got out of college that were not served as navigators. But many of the folks that we have are, you know, we're retired state administrators who just needed to fill that gap between when they retired and 65 years old when Medicare kicks in. And so we've got college professors who have served as navigators. You know, those folks that are used to helping ordinary citizens understand difficult governmental language and websites and things like that. So, sure. Yes.
Following up on that, are the people who do the Navigator work, are they part-time employees who are only hired part of the year?
No.
Or are they
So-
full-time employees?
I think throughout the state, throughout the nation, Navigators looked at different ways of doing that. Some employ people just part-time through this. What we do is we see this as a year-long process. And so our navigators are, you know, hired. They're hired. They're full-time, 40 hours a week. They're salaried employees. And they, like I said, they work on a number of things. One of the additional things we do that we started is we have what's called From Coverage to Care. And that's our health literacy program. This is where we spend a lot of time, not just with organizations and consumers that we're working with, but we spend a lot of time at businesses who call us and ask us to come in and provide health literacy changing. You know, for many of these folks, this is the first time they've had access to health insurance. And so they need help in understanding, you know, really what is a primary care physician and how do you access the free preventative services that are afforded to you under the law? How do you follow up? You know, what do these mean? So we spend a lot of time providing both group counseling, and we talk to groups like this, or we provide one-on-one counseling throughout the year on health literacy.
Have you written any letters or op-eds to the newspapers?
Yes.
And,
Yes.
What has been the feedback?
Well, we you know, we put this information out there. You know, this is Louisiana's a tough state for that. You know, we both get that. You know, I think what's interesting is we get a lot of people who, you know, take government out of my health care. You know, and I look to see who wrote this, and it was a person that, you know, presumably is over 65 years old, receiving Medicare, who's complaining the government is running their health care. You know, and we get a lot of that. the law has affected so many different things. You know, I think one of the things that I think that is probably, and I just realized I'm not repeating the questions, and I completely apologize. There is this huge note right here that please repeat the questions, and you get caught up in all of this. You know, one of the things that people don't realize is how the Affordable Health Care Act has made an impact on employer-based health care. Prior to 2013, when they go in, when your insurance company goes in to provide insurance to an employer, what they're going to do is, let's just say you're a company, okay? We're going to look at your age and what your health outcomes are. We're going to look at you, what your health. Okay, good, thank you. I didn't mean for you to. Good for you. They're going to look at your health outcomes. Okay, they're going to look at your health outcomes. They're going to look at your health outcomes. They're going to put it together. They're going to divide it by the number of people that they're going to employ, and that's where you came up with your premium. Okay. One of the things that the health insurance, the ACA has impacted is no longer do they do that. They're not looking at health outcomes. They're looking at your age. So now what they do is we'll look at your age, we'll look at your age, we'll look at your age, and because I can see that two of the people are much younger sitting at the table, you know, that has an effect on the insurance because it's now based on age and not health outcomes. And so what we do is we see, that's why a lot of times what we've seen is we've seen the employer-based insurance go down as far as premiums, but you don't hear a lot about that, and that is just one of the side effects of the Affordable Health Care Act. No other questions? Yes, sir.
Prior to the Affordable Care Act, institutions like Our Lady of the Lake would say if you went in for a $100,000 heart issue, that $20,000 to $25,000 of that bill was going to support people who couldn't afford to pay. Today, the Affordable Care Act has people that may not be able to afford, say, $1,800 a month for a family, paying off of a schedule several $100s a month, and then when they go to the doctor, they also pay a deductible to get in and see it. And as my wife would say, welcome to the real world. So those people are now paying a portion, and it would seem that that would take some of the pressure off of that $25,000 when I'm in the least possible position to donate it for the future. So wouldn't the Affordable Care Act system seem to be more rational than the previous system that we had prior?
That is, and that is exactly part of the reason why this was created, was to take this benefit, to take the burden off of the folks who had insurance and spread that out there, and to help consumers who were below 400% of the federal poverty level be able to afford that. And so you're exactly right. I mean, this is what we've seen. This is why, as we look at several of the different changes that have proposed throughout the year, AHCA, BRCA, Graham-Cassidy, this is why you have places like hospital administrations and all of the trade associations around healthcare. Not one of those organizations stood behind any of these changes.
May I have a clarification follow-up? If someone went to the marketplace to get health care today, even at most minimum, that would prevent them from next year being penalized when they do the taxes for 2018 if they've had health care for next year.
That is correct. So what happens is, at the end of the year, when you go to reconcile your taxes, one of the questions that you're going to get, and you get a 1099, what? 1095, thank you. A 1095 at the end of the year. And that 1095 has 12 different boxes, January through December, okay? And each one of those boxes that you carried healthcare has a check on it, because what they're going to do is they're going to look at not only did you have healthcare, but did you have healthcare for all 12 months, okay? Or for 10 of those 12 months. And so there's a 90-day, if something happens and you lose your job and stuff like that, pass. But that is how you reconcile that at the end of the year. And if you did not have that insurance and you did not have that information on the 1095, then you're going to pay the fine. And I get it. We hear this a lot. Okay, a lot of people say I can't afford it. And it's cheaper for me to pay the fine. We hear people all the time, and this doesn't matter what part of where you are on the federal poverty level. Many people work to make ends meet. Okay, no matter if you've got a six-figure in annual income, you can still possibly work to make ends meet. Okay, and so they couldn't figure out how to do that. And so what they tell me, what we heard a lot of consumers say is, instead of me having to come up with this money each month, Instead of getting a $6,000 refund, I just assume take a $3,000 refund and not have to worry about it. And so, that is part of life. For some people, that's how they look at things. And so what we try and do is make sure that they understand, especially in this year in 2018, that before you pay a penalty, sit down with someone and let's look and see, because there could be a plan that doesn't cost you anything per month, and at least you have the safety net. Without it, you have no safety net, and you owe the federal government money at the end of the year.